Hello. Welcome to another episode of Behind the Wheel, Uber's podcast made entirely for drivers and couriers. It is always a pleasure being here with you all. I am Maria Fernanda Resendiz. I am your host for today. Thank you so much for joining us. Today, we have a guest with a very special story. You've heard already that some of Uber executives say they get behind the wheel and go out driving and delivering with the Uber and Uber Eats apps from time to time to learn and to better understand what is it like being a driver, what it's like being a courier. Well, Julia, our guest for today, knows the driving experience very well because she used to be a driver herself. Julia, welcome to Behind the Wheel. It's an honor having you with us today. How are you today?
I'm great. Thank you for having me. Excited to be here.
Fantastic. It is a pleasure for real. So, Julia, please tell us about yourself. What are your passions? What are your hobbies? What moves you?
What moves me is really my career. I am a dedicated healthcare professional. I have been in healthcare for 27 years. So it's a passion, it's a labor of love. I also love animals. So on the side, and even when I was Uber driving, when I would take my breaks, I would often go to our local animal shelter and I walk dogs. Yeah, I do their laundry, their poopy laundry, just anything I could do to help at the shelter. So I just, have a love of animals and I'm a mom. So love the kids and, they're grown-ups now, but that's kind of like my world, work, dogs, kids.
That is adorable. I love dogs. I love puppies too. I think a lot of people will agree with me that they are super, super cute. So thank you for sharing that. Now, I am curious, what drove you to using the driver app? What was it about the driving experience that fit your life or that fit your needs for you to choose it? What is it that made you click that button? Like on the very first day, how did you feel? Like what made you click on that blue button and say, go?
So, great question. At the time, this was 2015, Uber was fairly new, and I had been hearing a lot about it, and I needed to earn. I had a child in college, university, and wanted to help her out. So, to kind of take care of household expenses, it seemed like a great way to earn money. And it was on my own time, at my convenience, my car. And I thought, I'm going to try it. And if I hate it, I can just turn it off and I never have to do it again. And at the time, too, my kids, again, like I was, getting into that empty nest phase of life. And so I had time and I went ahead and went for it, went down to the green light hub, got set up, pressed the button, and I'll never forget the first rider I had. I said, by the way, you are my first rider ever, so forgive me if I look like I don't know what I'm doing, because I don't. And I just remember they were so kind to me. And at the end of the ride, they told me what a great job I had done and that they were going to give me a 5-star rating. And I see the money pop up, I get a 5-star rating, and I was hooked. I was kind of hooked into it. I was only able to do it part-time, but it just really fit my life at that time and what I needed.
That is very inspiring, and I'm sure a lot of parents and a lot of drivers are gonna agree with your story. Like they're gonna have some coincidences there, and I'm glad to hear that your first ride was a 5-star experience from start to end. That's really reassuring. So, you can tell us more about that first day or like any other regular day. I'm curious, how did a day driving with the app used to look like for you? I can only assume that if we compare that first ride with, I don't know, maybe a few months in after driving with the app, it was like your routine looked very differently. So, how did you prepare or plan for it?
Absolutely. So I'll say I ended up having two different routines. So when I was a part-time driver, my routine was Friday night, Saturday, Sunday, because I had a pretty demanding, job, like 5 days a week. So it was at night, on the weekends, and I had a system. I would start out early in the evening. And my thing was, I will take you to the bar. I will not be there when you get out of the bar. That really was something that I just never felt that was for me. And again, I loved that I had the flexibility to turn off. So I would always be done by midnight. So making sure, like, even if I'm like, mid ride, and if it was like, midnight, 12:10, that was it for me. And then I'd go home. So I think when you find a system that works for me, it was predictability and how I could earn, where I felt safe too. Really looking at my surroundings as a woman too, a woman driver. And especially in the early days of Uber, I would have riders tell me all the time, like, oh, wow, like a woman driver. Okay. I think now it's much more common, but I think in the beginning that was a comment that I had often. But yeah, that was my system as a part-time driver. And again, if any time it wasn't working for me, shut off, go home. I'm not feeling it, go home, take a rest. And then I would say on the full time, I drove full time when I was laid off from my job. And I'm so grateful that I had Uber to turn to. It paid rent, it put food on the table, it took care of my family. And it became not just extra cash, but my critical living, my ability to live cash. And at that point, again, finding a system, right? I've already been doing it now for a few years before I ended up being full time. And I would have a system where I'd get up at 3:30 in the morning, be on the road by 4, right? Finding my locations, doing all those airport trips. Airport trips were the best. I loved those a lot, especially like people going to work, right? People going on business trips, like I had been doing, right? But here I am. I'm like, okay, I'm a driver now. I'm a full-time driver. So just finding a system that worked for me, and then finding those downtimes where I could go home, rest, take a break, reset, and then head back out in the evening. So I'm sure most drivers have a system that works. Where the top earning spots are. When you need to rest. And I'll get to that, like, hopefully later on too. I want to talk more about that.
Please do tell us more.
I would say self-care is so critical when you're driving. And I think it was something where I needed to earn. I needed money. I needed to pay rent. I needed to buy groceries. And, I know that a lot of drivers will drive the 12 hours and then Uber shuts you down, right? You need to rest. A lot of drivers do that. And I think a lot of drivers drive 7 days a week. I couldn't do it. But I would say self-care was so critical, because my ability to show up in the car refreshed, reset, and in a good headspace, physically and mentally, allowed me to, I think, be at my best. And I'm proud of my rating. I was a 4.98 driver. I had thousands of trips, right? Over from 2015, I drove all the way through the end of 2019. I did not drive during the pandemic, not driven since. I'm going to work on that though this year. I'm going to get back out on the road. I want to see what it's like now, right? It's changed a lot over the last few years, but I just want to say that I think self-care is just super important, and that's going to look different for everybody. But taking that break, taking a day off, taking an afternoon off, whatever it might be, popping into a movie. I do like $5 movie day, right? I didn't have a lot, like, every dollar counted, right? When you're, that's your living. Pop into a movie, get in the pool, take a nap. Just those little things helped me kind of show up, like, just really ready to hit it when I would turn back on. So,
Julia, it sounds like you and I could be best friends, taking care of puppies, going to the movies, taking a nap. Those are my favorite things too. And now
right?
you've mentioned many important things that I wish I could be taking notes right now. Like you mentioned, having your own system, the flexibility, the ability to choose when to stop or when to pause, when to recharge. So that is all part of the magic and the flexibility that the driver app gives to thousands, millions of drivers and couriers out there. So, among all of that magic, what was your favorite feature in the driver app?
The ability to cash out. Literally, that was my favorite feature of the app. The ability on a daily basis to be like, cash out, I need the money. I need to pay a bill. I need to go get some groceries. So for me, it really was that immediate instant gratification moment, even though it had a slight fee to it. It was ever so slight, but that cash out feature was big to me. And I do want to mention one more because I know that I believe there are more insights available to drivers now than when I drove, but I really did appreciate the insights I did have at that time to understand my pickup and my drop off, like, right, where I'm going. And I could make the choice and I could look and say, yeah, I'm not going to that entity. I'm not feeling comfortable with that. And just that ability to make that decision and have that insight into pickup and drop off, that was a big deal. Yeah.
I'm sure it was. Now, talking about the driver experience. Now, did you ever deliver with the Uber Eats app, and which one did you prefer, driving or delivering?
I did both. I would say I preferred driving. And I'll share why. I would do Uber Eats because I'm an extrovert, if you can't tell. I love talking to people. I really enjoyed it when a rider, I would call them my customers, when they wanted to talk, I loved it. If they didn't, that was fine too. But I'm definitely an extrovert and I loved the conversation. So I would say there were times when I would hit a wall, right? I've been driving 8 hours. I live in Orange County, but I would be in Los Angeles traffic and I'm tired, right? I'm a little bit tired. So sometimes I would switch over to Eats to kind of get away, like reset from the human experience. But I will say that sometimes with Uber Eats, for me, what would happen is I would switch back to people because I just, from an earnings perspective, it was more for me. It was more lucrative to do rides, and I would say sometimes the food smells. I know that sounds crazy. I'm sure drivers out there are going to know what I'm talking about. It would kind of permeate my car, and then I would drive around with the windows down. Like, this is real talk, right? Like, air out the car. I want to drive people again. But yeah, I know everybody has different needs, right? Drivers, couriers. There's different reasons why people would do one or the other. But I preferred the rides. I preferred having people in my car.
I'm learning so much from this conversation, Julia. You have amazing insights to the driver and courier experience. Thank you so much for sharing them. Now, talking about sharing, what's the best advice that you received as a driver or as a courier that you'd like to share with all of the drivers and couriers listening right now?
I'm going to probably harken back to what I was sharing earlier. I would say the best advice was the advice that I gave myself. There's two. So I'm going to do two if that's okay.
Of course.
Okay. So I'm going to go back to the self care, right? Like, just really knowing yourself and when you've hit that space, giving yourself a day off. But again, I understand that as a driver, most drivers are driving to earn. They're supporting families. I supported my family on Uber, so I get that sometimes there's the reality, but I think finding those moments, you can find a little pocket, to do something for yourself. I think that's key. I would say the best advice I ever received, because as a driver, I would call them like the hangout spots, right, in my general neighborhood, right. There were certain gas stations or areas where other drivers were, and I did get to know some drivers, people that I still talk to today, actually some. And I would say the best advice that I ever got from another driver, and this was when I was newer at it, and I remember he told me, he was like, and it was the system. You've got to find a system. And he was like, in the beginning, I would just take everything. And he said when he was new, he took everything. He would just turn on the app and do it all. And that was how he figured out his system, was by kind of, just being open to every trip, except, to find out what didn't work. And I will say, for me, that was key for me, in what I did for my own system. So that was probably the best advice I ever got.
And that makes a lot of sense. It's such a
Yeah.
unique experience for everyone driving. Like, I'm sure your experience is different to those who are listening, and I really hope that they've find their own system already too. Julia, if I heard correctly, you mentioned thousands of rides. So, was there anyone in particular that stood out or that you remember? Any great rider interactions that you want to share?
Yes. I've had so many, but I will say a couple that stood out to me were situations where I one is a situation where I picked somebody up who was going to her husband's funeral. And not to be a downer, but it was, this is what we're doing as drivers. We're serving our communities. You could be picking somebody up on the best day of their life. I picked people up who were, going to weddings and super excited and going to parties. And then I would pick people up who were being evicted from their homes with a suitcase, breakups, fights. And one that stands out to me was a woman that I picked up at the airport who was going to her husband's funeral. She was an elderly woman. They had been married for decades. And I remember she just got in my car and I was greeting her and just, wasn't trying to start a whole conversation, but general, hi, how's it going today? Hope you're having a good day. And then she just started talking. And so just that ability to be present and listen to another person on a really challenging day in their life, that's just one example, but I face that so many times, right? Picking somebody up from the hospital where they had just had a really challenging night or they got a challenging diagnosis. And I always felt like I was like the bartender of the car, right? People would tell you things that were amazing and surprising and would confide if, when you start a conversation. So I don't know, those were moments for me where those are standout moments where I could just listen and be present for somebody going through a challenging time in their life. And I saw myself as being like, sometimes, when you're having a hard day, driving's hard. It can be challenging. It can be very tiring. Sometimes you get riders who are, there's challenges, right? So I just always, in those moments, it was a reminder to me, like, I'm here in service. This is what I'm doing. I'm servicing my community. I'm in service of other people. They say, like, what, when you're lost, be of service, right? And there are times in my own life, driving, I don't have a job. I had this career. What am I doing? I'm here. Somebody needs me today. They needed me to take them there, and I was there to listen.
Wow, Julia, thank you so much for sharing that. That is a very generous point of view and a very generous way of seeing life. You make me realize that whenever we're having a bad day or we're facing a challenge, somehow it becomes challenging for drivers too. So it also makes me want to say thank you. Thank you, Julia, and thank you to all the drivers out there who are who are there for us. Thank you so much. And also couriers, sometimes if you're sick and you need like something warm or something that makes you feel cozy, it is really impactful the work that you're doing out there. So thank you very much for that. And now moving to a lighter note, you now work at Uber. Tell us about that. Tell us about your role. How did that change happen? What did that mean for you?
Incredible. Thank you. So I work on the Uber Health team. I'm an account management lead for Uber Health. I have, like I said, 27 years of healthcare under my belt. And I will tell you, I never could have imagined when I was a driver, if you had told me I would work for Uber, I would have said, you're insane. What are you talking about? I don't even know where I'd fit in there. So it wasn't ever a thought. And so my journey was I pretty much drove to the end of 2019. I found a full-time job. It was more than a full-time job, actually, in my field. It was great. Loved it. Didn't drive. Pandemic hits. We all go home, right? So I'm working with this company. It's, again, all good. I'm laid off in April of 2021. And I had just found this job. I had been out of work for quite some time, over a year. And so that was kind of tough. And I was pretty upset about it. And I thought, well, I can turn to driving. right? I've got an option here in my back pocket, right? So start looking, really hoping I'm not going to be unemployed for another year, year and a half. And I looked on LinkedIn and I saw an opening for Uber Health. And I thought, Uber Health? What in the world is that? And as I researched it, I realized I was actually doing Uber Health trips and I had no idea. Product was stood up in 2018. I definitely took people to and from the doctor, picked people up from hospitals. I was doing it and I had no idea. So I put in an application for account manager. That's my experience as account management. And I thought, this is incredible. This is incredible. So went through the process. I never shared that I was a driver. Um, yeah, I mean, it wasn't necessarily on purpose, but I just didn't really share. I wasn't like, oh, I was a driver. After I was hired, I shared, I'm like, maybe I should tell them this because I think this is going to come into play. And I told our head of Uber Health, Caitlin Donovan, I said, I was a driver. And she said, oh my gosh, no wonder. She was like, one more reason that we should have hired you. So this is great. And so, yeah, it comes up for me often in my role. I love that I'm able to share with my team the experience of the driver. When we face issues that our business clients bring to us regarding trips, I just hearken right on, like, well, I hear what you're saying. However, from a driver's perspective, here's what they're experiencing too. So let's pull in. There's a rider, your rider had an experience, that driver had an experience too. So I really love that I get to use my driving experience and my healthcare experience. And I feel like I'm in heaven with what I'm doing right now. I feel like Uber Health is going to make a big difference in the world. We're addressing social determinants of health, which is barriers to care. We're getting people to care through our drivers that ordinarily would not be able to get there for a variety of reasons, socioeconomic, lack of transportation, so many reasons. But Uber Health, you're getting them to appointments, you're getting them to just what they need to avoid that emergency room trip, is just one example of many.
I love it, Julia. And I'm sure I speak on behalf of all those drivers and couriers listening right now. Please keep bringing that driver perspective into your meetings and into your work every day. Thank you so much for doing that. I'm sure, I have no doubt, it really makes a difference. Now, Uber Health. It's such a unique and impactful product, but please tell us more about it for those that may have never heard of it, that are maybe taking Uber Health trips but are not aware that they're doing so either. What is Uber Health, and what is one thing you'd like everyone to know about it?
Uber Health, I guess we could do a whole nother hour on Uber Health. But in a nutshell, for this purpose, Uber Health is essentially, again, we are utilizing the driver pool to assist providers and health plans with transporting membership to and from their appointments. Again, this is non-emergency, right? These are riders who have, the mobility is there, they're ambulatory, and we're just getting people to and from primarily their medical appointments to get their care. We've also added in grocery delivery. So we're addressing, again, these social determinants of health. Maybe people live in a food desert. Maybe we've got somebody who has a cardiac situation, or they're diabetic and they need a particular type of diet. So really utilizing the Uber Eats platform and the grocery delivery to bring healthy food to people who need it. And primarily we're working with the elderly. We're working with Medicare Advantage recipients and Medicaid, again, trying to address these barriers to care and healthy food, and also doing prescription delivery too. So it kind of goes back to the getting anything, anywhere, anytime, right? But in the healthcare space.
Wow, wow, wow. Everything about this conversation has been amazing, has been inspiring, heartwarming. Thank you so much, Julia, for sharing this with us. Thank you so much for everything that you do for our cities, for our communities. And that's it. Thank you, everyone, for watching. We hope to see you next time behind the wheel.